I think when people say Black Lives Matter, it's like we have to say that because we have seen in so many different ways in this country that Black lives really don't matter, even within healthcare, despite advances in medicine and technology and innovation and research. A lot of people think this distrust that Black patients have for the healthcare system comes out of the Tuskegee experiment. It was a federally sanctioned experiment, but I would say that, that distrust happened well before then. There are these very deeply rooted systemic beliefs connected to chattel slavery times where, there were reasons that needed to justify why one set of human beings sell another set of human beings as property. And so even enslavers who were physicians, they said, Black people are different. They are biologically different than white people. They are biologically inferior than white people. There's another story about Henrietta Lacks, who is an impoverished Black woman and mother from Baltimore who went to Johns Hopkins in her early 30s and had some of the tissue from her uterus removed without her consent. And that tissue then went on to be used for research, and millions of dollars were made off of that tissue. And her family only recently found out about this. And those sort of instances breed distrust between the healthcare institution and Black patients. And then what happens on a community level and a more systemic level is that we have these discriminatory housing policies that originated in the 1930s, like redlining, that led to primarily Black neighborhoods and neighborhoods of color being disproportionately disinvested in. And we also know now that those communities today have the very worst racial health inequities. You go to any major city, you look at those redline areas that have not been gentrified, and those areas have the highest maternal mortality rate, the highest infant mortality rate. And they are more likely to be in neighborhoods that have fewer hospitals, they have fewer clinics. And we do know that hospitals that are termed minority serving hospitals, that typically when researched, the care that they provide is of inferior quality. They are less likely to have specialists. They are more likely to have fewer resources. And so even the quality of care is compromised at those hospitals in these neighborhoods. And so what that creates is this horrible self-perpetuating process that happens where Black people are like, I don't want to go get this issue taken care of because, one, I don't believe that I'm going to be listened to, or I don't believe that facility is well equipped to take care of me in the way that it should be. So, one issue that comes out a lot current day is this idea of pain inequity, that Black patients and patients of color, often their pain is undertreated or even sometimes ignored. And we have documented cases of this where someone may go to ask for help, say that they're in pain, and they get shooed away, and they end up going home. And usually what happens is that pain is related to an underlying diagnosis, whether it's a heart problem or a pregnancy that's in the wrong location, but that could actually potentially be life-threatening and cause the person harm, injury, or even death. So it could be really, really serious. We even had a study in 2016 with medical students and residents, so doctors in training. They were assigned two cases. The cases were exactly the same. There's a Black patient and a white patient, and they were asked to score the patient's pain and then talk about how much pain medication they want to give to the patient. And they consistently, majority of them, underscored the Black patient's pain, and they were more likely also then to give the Black patient less pain medication. And those same doctors and student doctors were also more likely to believe in these false beliefs about Black patients, like their skin is less sensitive or their skin is thicker, false beliefs that the authors of the study had made up. So, we have to be very much aware that our physicians and health professionals live in a society where they are also absorbing all of this cultural messaging about Black people and the differences that Black people have, even though they're myths, compared to other people, that actually informs how they are practicing and caring for patients. So racial concordance is this idea that the race of the patient is the same as the race of the physician or the health professional. We have studies that have shown that with Black physicians, Black patients are more likely to feel seen, heard, and appreciated. after an interaction with them, they're more likely to take their advice regarding getting vaccinated. They're more likely to follow their recommendations. They're just more likely to do things that are better for their health. And so that speaks to the necessity of having a more diverse healthcare workforce, because we know that our US population is about 13.6% Black, and we have less than 6% of physicians are Black. So we know that is an issue. But I think the other issue is also making sure that every doctor is equipped and competent and able to take care of any patient, regardless of their racial background. But the problem is that we're seeing that's not always the case. So we have to think about, how are we educating, how are we training, how are we doing continuing career development with our physicians. And I think about my own medical education and what could have been different and how it may have failed me. And there were glaring gaps in my education. And a lot of it was because in medicine, we are taught that the relationship that we have, it's the physician and the patient. And whatever happens in that sacred exam room or that clinic room is the only thing that matters. When what's actually happening is when you're in that room with your patient, you know who's else in that room with them? Their family, their neighbors, their employers, the people they go to church with. There may be food insecurity, housing insecurity. Those are called the social determinants of health. And we know those are actually impacted by systemic racism and other types of systemic policies. So that's why I think it's imperative for medical schools to really think about how we care for our patients in a holistic way. So we're thinking about all of the things that impact their health. To be totally ignorant of what's happening in someone's community, like at the community level, is really to ignore part of what makes them or determines their health. And not that like a physician should have all of the answers. No one's saying that you should have all the answers to your patient who can't find food, who can't find legal assistance because their landlord is trying to kick them out unfairly. But you should be aware of how to assess that. You should be aware of how to make the connections to different social services that your patients need, because it's clearly, we know now that it's not just about writing a prescription for your patient. It's not just about telling your patient stop drinking alcohol or eat healthier. We know that health is so much more than what happens in that exam room. My biggest message for people who read the book, and even the broad audience, but it's for them to think about like who you're voting for, thinking about the decisions that policymakers make around what health looks like. And I always talk about health in all policies. And so you want someone who's going to be not only thinking about, yes, everyone deserves to have universal health care, right? But also everyone also deserves to have, family leave and paid leave, right? Because we know that makes people healthier. That people also deserve to live or work in a place where there are workplace protections. People deserve to be able to have safe and affordable housing or to have gainful employment. So thinking about how can we use policy to create opportunities for people to live healthier lives. Like it's not rocket science, but I do think that it's about finding those policymakers that you align with in terms of what is important to you. And if what's important to you is building a just and equitable society, then you are going to vote for people who also agree with those policies.